everyone, and welcome. My name is Mark Hagland. I'm Editor-in-Chief of Healthcare Innovation, and I'm here today with Russ Fendley, who is Vice President of Strategic Development at HealthEC. I'm excited to be here with you, Russ. Great to see you.
Oh, thank you, Mark. I appreciate it.
We're going to talk about Medicaid, and this is such an interesting discussion. I just received in email a report from AHIP, the America's Health Insurance Plans, about some of the innovation taking place right now in Medicaid managed care. There's a lot going on. Let's talk though about Medicaid in the context of what's happening now with the COVID-19 pandemic. Is that okay with you?
Sure.
Great. It's such a complex time. Let's start at 40,000 feet, Russ. I'm going to ask you at a very high level, and then we'll drill down. What are the biggest challenges right now for Medicaid programs nationwide at this time as they face this pandemic?
Well, there's an old saying in the Medicaid world: if you've seen one Medicaid program, you've seen one Medicaid program. And I say that only to mean that the challenges are going to be different from state to state. But there's a couple things that are universal. Everybody had to go back and make really very unusually quick changes to waiver programs and eligibility standards and state plan amendments to address new enrollees and new treatment options and so forth. So it's been that's a challenge for everybody, simply because you can't stop normal day-to-day operations. So these are above and beyond what you would normally do. And then you've got, in some cases, tens of thousands or hundreds of thousands of new enrollees joining the program. So there's all the operational issues of dealing with new enrollees and getting them assigned to managed care plans and making sure they have the proper identifications and the education, and there's physicians assigned, and there's all of those issues that have to be addressed. And then there's the financial issues that, again, every state's different, but every state is saying the same thing, and that is we're feeling the crush of the new enrollees now and not quite sure how they're going to cover those gaps.
Exactly. So it seems to me that we have three very large buckets of issues. We've got the financial that you just mentioned, the operational that you elaborated on, and also the care management, because as you know, since you've been working in that world, virtually all of the state governments have moved into managed care for Medicaid. Some are much further along than others. Some are pioneers and others are kind of coming up at the end. But what they all face is really rethinking how they manage the care of these enrollees, and there's a lot of challenges underlying that in terms of data and analytics. At the same time, they're facing these huge operational and financial challenges. Let's talk about that combination of challenges, if we could, Russ, especially around data and analytics, because analytics will be needed now more than ever, correct?
More than ever. It's a particularly acute challenge at the state level for a number of reasons. When you're dealing with a pandemic of this nature, the issue doesn't necessarily reside in Medicaid. Medicaid is a tool to deal with the issue, but it's primarily coming through the public health domain in the state, and you would have other entities in your Health and Human Services cabinet who would be involved in that. But the problem is that my knowledge, there are very few states, if any, that have a robust analytics data warehouse engine in place that can collect the data from all of those divergent systems in a state environment and put them into one place so that you can have one set of data.
Right.
That is a huge issue at the state level. I've had conversations in my home state of Kentucky, and I've listened to our governor on multiple occasions saying that one of the frustrations is you're always late to dealing with the next outbreak because the data you're getting is probably a few days old.
Yeah.
And so it is a huge issue, and it's one that states have dealt with for many years.
One of the things that I'm interested in is how state governments, how Medicaid program directors are going to make sure that they're really able to analyze the patient care outcomes, quality outcomes, and financial outcomes now in particular, as they've got all of these things going on. Can you address that?
Well, a lot of that's going to come from the MCOs who are doing the work, but one of the things that's missing is that there's not a good set. Most of these states, in fact, I don't know of one state that does this particularly well, where they have a robust set of quality measures that they're using to judge the care that's being provided, not only at the health plan level, but down to the individual physician level and to the individual participant. So that piece of it has always been elusive to the states up to this point. They've allowed the MCOs to kind of drive that piece of it. So that's one of the things that we've been working on with states, is bringing them, the quality measures that they need in order to accurately look at the care that's being provided on a real-time basis. A lot of states are looking at quality data that's 2 years old. 2-year-old quality data is worthless.
Yeah.
Getting that quality, and if you're, especially during COVID, you want to have access to that data because there may be specific treatments that are occurring,
right?
Resource allocation issues where you've got a hot spot here and you need to allocate resources appropriately. That kind of data and that kind of quality analysis right now is not available at the state level.
That's really challenging. And to add on to that, one of the things that would be incredibly helpful, but I know it remains a challenge, is social determinants of health data. When and how and where will SDoH data? I mean, I know it's adding on top of, we're getting close to the straw that broke the camel's back here, but how do you see social determinants of health data eventually being added in effectively and analyzed? Because in my interviews with leaders in Medicaid managed care, it's huge. That's a huge element. It helps determine very often what's really going on with an individual is more SDoH related than purely medical, or it determines the scope of the medical issue, the clinical issue.
And I'll take it a step further, and that is both from a social determinants of health and from a mental health perspective. Both of those we're learning more and more are key cost drivers or key cost determinants are helping to drive the cost down, is having access to the social services, or access to social services, or a network of social services. Again, it goes back to the problem that we have, and that is that at a state level, you may have 24, 25, 26 different agencies that could touch an individual recipient in a state at any given time, each with their own systems,
right,
and no central repository for that data. But then once you collect that data, you have to have the ability to do something worthwhile with it. There has to, you have to have a a social determinants of health module, if you will, that says, here is a game plan. We've got a care manager who's going to look on here and say, who needs food, who needs shelter, who needs transportation, who needs, pharmacy deliver, and then networking with the appropriate resources in the community to deliver that. That will not only bring savings, the MCOs know this is a cost-saving measure for them, and most of them have implemented that. It's a little more difficult at the state level because the state has to drive the data, because the states are a little slow in seeing the return on investment at this point. Yeah. We've been talking about it for years. It's just nobody has really, I shouldn't say nobody. They're starting to move on it. Tennessee's moving on this now and making real strides. We're actually working with them on that. So there's action happening, but it's becoming even more important as a result of COVID. I think you're going to see it get steam in the next year.
Well, and that you perfectly teed up my next question, which was COVID related. So we've talked about outcomes, both patient care and financially. We've talked about SDoH, and to me, COVID sits right in the middle there, because as we know, the communities who are being the hardest hit are communities of color. Those communities also are the most impacted by poverty. So there's in many cases, people are saying, well, for one thing, many people in some of those communities are not able to fully socially distance. It's too difficult. They also, in many cases, are frontline workers. They're working in food delivery and etc.
Yep.
So what is your vision of how at some point we're able to truly activate all these different types of data to help providers and to help the MCOs to identify early plan members who are really at risk for COVID?
Oh, the sad part about this, Mark, is the capability is already there. And again, I don't want to toot our horn too much in this, but we actually have the capability now of taking data, either claims data from the state Medicaid program or data from the health information exchanges, or from direct from physician electronic medical records, and you can identify right now who your at-risk people are, where they're located, what medications they're on, when they have doctor's visits, what their needs are, and really you can pinpoint them now and help the MCOs or help the state say, okay, here are the people we need to focus on. Here's the care that they're going to need. Here's the instruction they're going to need. Here's the assistance they're going to need. They may need help with food delivery. They may need help with special transportation. The data is there. The mechanisms are there. What's got to happen is to marry those two together, and that's going to take an investment on the part of the states. The federal government has allotted money through the CARES Act to do that. Unfortunately, what we've seen in the past is there's a multi-year process in order to get that done, typically at the state level, and we don't have that kind of time. But that's what's got to happen, is there's got to be a better use of the technology that's already there to help states combat this, and right now that's the struggle.
Exactly, and ultimately, we're really talking about predictive analytics, correct?
Yes, exactly.
What's, from a software technology standpoint, what do we most need? You were talking about the classic challenge, marrying clinical and claims data, and now we're talking about predictive analytics. What's missing from a technology or platform standpoint?
Well, what's missing at this point is just getting the right analytical tools in place I mean, most of the health information exchanges that are out there in the country, and this isn't universal, but it's true in a lot of states, were never fully developed. So they're shells of what they should be. They were never fully developed. So they're only a partial solution at this point. You're going to have to go to multiple data sources to get a clear picture, a true picture. What needs to happen is there needs to be a movement to go to an integration of all of the data sources at a state level. And even they started this a little bit at CMS a few years ago, even collecting this at a federal level, although I think there'd be a lot of pushback on that. But at the state level, a collection of this data, both social determinants of health data and the medical data, and connecting it with the electronic medical records of the physician, you would have a universal picture. And I know that scares a lot of people to think about that because there's data privacy issues and all the other things that have to be accounted for. But that is really where the end game is. That's where you're able to sit back and say, the first time somebody presents with any of these symptoms, we can react. Right now,
Exactly.
we're weeks behind, and by that point, it's too late.
Right. Well, I think the future, as challenging as it is also a little bit exciting in the sense that if there's any clarity to come out of this pandemic, it's that it's showing us where all the gaps are in the system, correct?
Absolutely.
Yeah.
That goal is we're finding out where our gaps are. Exactly.
Exactly. And so I'll ask you for a final comment on what would your advice be for healthcare IT professionals who will be helping to do all of these things? And I mean, primarily on the provider side, but also anyone who's working with Medicaid and anyone who's on the plan side.
Wow, that's a great question. One of the things that I think we've got to focus on, I go back to it again, is it's one thing to collect the data. It's another thing to make it actionable. And a lot of times we tend to get caught up in thinking about the technology and not the actual end use, the operationalization of the data that we have or the processes that we have. I always I'm not a technology guy by heart. I'm an ops guy, right? That's my background. So I look at things of some of these the applications that are available and think, okay, how can I improve the operation? How can I improve public policy? How can I improve using these tools, these widgets? And we've got to get away from having a discussion about whether something is SaaS and cloud-based and all these other things, and think about what is the practical application of this at a state level to address specific policy initiatives and needs. And because we keep dancing around the same issues about approach instead of fitting the need. And hopefully we can get past that and come up with some clear direction. And that starts, frankly, at CMS, because they've danced back and forth on this for the past 10 or 15 years.
Exactly. I agree completely with you. Anything else that you'd like to add right now?
I think there's a lot of good things that are going on. I know that there's a lot of push. My heart goes out to my friends in the Medicaid world. I know they've got their hands completely full. I know that states are going to have major budget issues in the coming, not only for the end of this fiscal year in June 30th, but the next fiscal year. And we need to be mindful of this, that this is not going to be just a Medicaid issue.
Yeah.
When you start having, major budget gaps, that impacts every program in the state, and it's going to impact education. It's going to impact roads. It's going to impact parks. And it's going to impact everything. And we've got to be mindful of these things and start thinking about where where we cross the barriers between the economic side of this and the healthcare side of this, because the two have, there's a place where those curves cross, and we're at that point now, I'm afraid. And then we're going to have to figure out a whole new way of dealing with this going forward.
I agree with you completely, Russ. And thank you so much for your wisdom today. It's been great to speak with you, and I want to wish you all the best.
Thank you, Mark. I appreciate it. Good talking to you too.
Thank you very much. Have a great day, everyone.